Global Health Grounds. It is my pleasure this morning to welcome you all to this special session that we have Ms. Katherine Flowers, and to introduce her. She is an environmental activist bringing attention to the problem of inadequate waste and water sanitation infrastructure in rural communities across the United States. And as founding director of the Center for Rural Enterprise and Environmental Justice, she builds partnerships to identify and implement solutions to the intersecting challenges of water, sanitation, infrastructure, public health, and economic development. As we'll hear this morning, having grown up in Lowndes County, Alabama, an area plagued by poverty and failing infrastructure, her work has demonstrated how lack of access to sufficient, sustained waste treatment and clean water can trap rural, predominantly Black populations in a vicious cycle of poverty and disease. In 2011, she worked with the UN to demonstrate the startling level of poverty in Lowndes County and the southern United States more broadly. Later, with Columbia University Law School Human Rights Clinic and the Institute for Study of Human Rights, she published an examination of inequalities in access to sanitation and clean water within a framework of human rights. And she's also spearheaded a collaboration with tropical disease researchers who found a high prevalence of hookworm infection in Lowndes County, prompting the CDC to later undertake a similar larger study across the rural American South. Moreover, her testimony to Congress led to the introduction of legislation in 2019 to address neglected diseases of poverty in the US. As a former high school teacher, she was selected as a MacArthur Fellow, otherwise known as a MacArthur Genius, in 2020, and recently published her first book, Waste: One Woman's Fight Against America's Dirty Secret. In her work now, she seeks to broaden the scope of environmental justice to include issues specific to disenfranchised rural communities and galvanizing policy and research to redress failing infrastructure that perpetuates socioeconomic disparities in rural areas across the US. It's our privilege and my privilege to introduce her. We'll start with a short video, and then we'll turn it over to Ms. Flowers to speak to us this morning.
Katherine, bring us down to earth, and I mean that almost literally. Take us to Lowndes County in Alabama, where you've done so much of your work.
First of all, thank you for this opportunity. I'm a native of Lowndes County, Alabama. Lowndes County is the area where most of the Selma to Montgomery March Trail goes through. One of the largest slave trading ports in the United States came in through Montgomery. People in Lowndes County, we are largely descendants of those slaves that were brought in to work the soil. What I see in Lowndes County, a lot of hardworking people who are struggling every day to make ends meet. The wastewater situation, the raw sewage on the ground, when we found evidence of hookworm, which is a tropical parasite that's associated with poverty in Alabama. This is in plain sight. A lot of these people haven't been out of these ivory towers to actually go into these communities and see how people are living. I was called to a site, and I went out back with them to see the pit where the raw sewage was. It was in October, and it was teeming with mosquitoes. I was bitten, I had on a dress, and I had all these bites, and I didn't think anything of it until afterwards. My body broke out in a rash. Then I went to my doctor and I said, look, I was bitten by these mosquitoes. She did the blood test, they sent my blood in, everything came back normal. And I asked her, is it possible that I could have something that American doctors are not even testing for? Could it be that we have so many warm days that things that normally wouldn't live this long are living and thriving in this kind of environment? And that's how the connection was made. Where there's a woman who has 2 children, ages 9 and 16. One child is sleeping with a CPAP machine because she has sleep apnea. The home is a single wide mobile home that's full of mold and mildew. She got the mobile home in the late 1980s. The cost of it was about $127,000. She still owes $20,000 on it and is worth $2,000. That's an example of the type of structural poverty that exists. And recently I was talking to her and her sister about the wastewater situation, because when she flushes her toilet, the raw sewage is straight piped out onto the ground just outside the back of her mobile home.
Yes, I've been telling my story. I've been to Washington, D.C. and talked to the Congress and stuff like that. I'm poor. I don't have I don't have nothing. I try to take care of my 2 kids. And the Catherine is an angel to me too. She tried to help everybody, and in Lowndes County and around the world. She tried to help.
Most of the rain now is probably coming out of the trees. But I love this area. It's very peaceful, and I believe that somewhere in these soils of some of my people, I don't know who they are, but I believe they're in these soils, and that's what keep bringing me back here. When they settled the area, they wanted to come here because it was good for farming. It was the soils that were responsible for people bringing slaves. I'm a descendant of people that came by way of the slave ship, and a lot of people, their blood is in these soils. People are being threatened with arrest because of the soils, because the soils hold water, the same soils that were used to bring people here, and now the soil can't treat wastewater. I left to get an education. I left to get experience beyond Lowndes County. Because had I stayed in Lowndes County, for people that are in that area that see that all the time, think it's normal. But it's not normal, and it certainly shouldn't be normal in the U.S. Today I do this work standing on the shoulders of my parents. My parents were like the jailhouse lawyers of their communities. Also, my family was very, very involved in the civil rights movement. And because my parents being who they were, and because our blood has been spilled here on this soil, and because you go to just about any graveyard around here, you're going to find my relatives. So they don't understand that, and especially people that have not grown up in rural communities. So for those people that can't understand my passion for Lowndes County and why I do what I do, is they only have to come here. That no matter what I do or where I go, I have to go back to where I'm from, and this is where I'm from. And maybe that's why I keep coming back. You know, I think that's very important now in light of the fact that we're talking about immigration. And people tend to think that the fabric of this country only contains the souls of certain people, when it contains the souls of people from around the world. You know, and for us to deny who we really are as a people. And what I try to do is pass it on and nurture other young people. And I'm hoping that if I retire from this, doing what I'm doing as an activist on the ground, I'm going to continue to work with young people. This morning, I'm meeting with the summer interns from the Equal Justice Initiative. They're very interested in learning about environmental justice and the work that I do. And we're starting with the Lowndes County Interpretive Center. I'm very, very committed to finishing what I've started as it relates to raising the issues of rural infrastructure and the fact that a lot of these communities have been left out. And I feel that we have to be embedded in the community. And if you take nothing else from this, whatever you decide to do with your future, if you go into a community to work, stay in the community, spend time in the community. Classic third world conditions in the richest country in the world. It makes absolutely no sense. I can tell that I'm making a positive impact based on the people that have come to help. You know, this has been a long fight, but I'm getting attention from people who were not paying attention before, globally, even locally. Ellen can tell you because she was with me in Washington. You know, I don't move around like the average 60-year-old. My daughter tells me all the time, Mama, you're as old as some of my friends' grandparents, but you don't look like them and you don't act like it. I said, well, because I have to keep moving. You know, I can't slow down.
Well, I would follow her literally into a burning building. Let's do a selfie.
Oh, okay, cool.
What did she say on her shirt there?
Oh, my son.
Yeah.
Something about Grandma rocks.
Grandma does rock.
People of goodwill are coming together for the purpose of trying to make sure that we protect what God has given us. And I think, to me, that's indicative of making progress. And I felt like I was losing who I was. I would always come in something about me driving on 80, especially near the end of the day when the sun is setting. And I can see the sun setting in the west. And there's a place in Lounsborough which is beautiful, and you're looking here on the hills and you're looking out over that the horizon and seeing that landscape. That's who I am, and it's so important to keeping me grounded and balanced as a person. I'm an environmentalist because you cannot talk about the environment and not talk about health. You can't talk about the environment and not talk about how we treat nature. So part of environmental science is knowing about wastewater and how you treat it and how it impacts the environment, how it impacts the water bodies. All of that, I think, is connected. And that's why I'm an environmentalist. I've always been an environmentalist. Some people think you're only an environmentalist if you care about polar bears. But if you care about people and you care about land, you care about, God's creation, you're an environmentalist. And I'm very, very interested in what we do for 7 generations to come in terms of leaving a perfect place for our children to live.
Good morning. First of all, I always like to thank whoever was involved in inviting me to come and be a part of this. I've met Louise some time ago because of the work that I was doing here in Lowndes County around the wastewater issue. I also, quite some time ago, when I went to work for the Equal Justice Initiative, the first call that I received from them came as a result of them coming to visit Lowndes County with people from Partners in Health. And that was my first time hearing about Partners in Health. And I remember a week later, Evan Lyons and his wife moved to Alabama and worked with EJI. But we went on a trip to Lowndes County to visit some families. I remember Evan's wife saying to me, after going to a few households, there were individuals there that were dealing with various illnesses. And she said, Catherine, they said they went to school with you. They look like they're very, very sick. And I had always noticed that myself, but I never discussed that with anyone. And that was one of the many things that made me wonder whether people were being exposed to something that was not taken into account, and it was having a profound impact on their health. So my work has really, it started off as being economic development, and then from there to environmental justice, and now is at the intersection of climate change and health. And I think that all of this is all of those things that I mentioned impact health. And in Lowndes County is a stark example. In the video, you see Pamela Rush with her daughter. And I don't know whether you've had the opportunity to read the New York Times op-ed that I wrote about wastewater problems in the US, but it also talks about Lowndes County specifically, and it talks about the death of Pamela Rush. Unfortunately, Pamela Rush and so many other people have passed away in Lowndes County due to COVID. And Pamela had just turned 50 when she passed away. And I remember her calling me because she was concerned because a number of her family members had caught COVID at work, and where her sister in particular had COVID. And she said that her sister had asked her to prepare some vegetables for her. And she said, Catherine, I want to take them to her, but I'm really afraid. And she said that she had prepared them, and she would take them to her house and just sit them on her porch for her to get them. And little did I know that that would be a common way, or would become a common way in which people would provide food and other things that were needed for their family members and friends who had COVID, so that they would not come in contact directly with the person that was infected. But unfortunately, Pamela did come in contact with COVID. and passed away July 3rd of last year. COVID, I believe, has been a magnifier of all of these things that I've been talking about for at least 20 years now. The healthcare disparities that have existed in these communities for so many years because they've been trapped by poverty and all the things that are related to it. And then when you toss in the environmental justice layer of that, has made people very, very susceptible. A week ago, we had a funeral of a person who was the third person in the household to die. First, his father died from COVID. Then his sister died from COVID. Then he unfortunately caught COVID and died as well. And in these areas, people are dying because they're catching it at work, and they're going home to small houses or mobile homes where they cannot self-isolate. And as a result, the entire family gets it. And we've seen lots of people, because of diabetes and high blood pressure, cancer and other ailments, make them very, very susceptible. And we're even seeing in some cases where people are developing heart conditions and are dying of heart attacks that we didn't know had any pre-existing conditions. So COVID has kind of highlighted all of these things that we've been talking about. And of course, some of the things that I wrote about in my book, Waste. So just to give you somewhat of a background, as was mentioned in the introduction, I was a teacher. I decided to go back home. I had always been connected to Alabama. One of the things about coming from these rural communities is that it never leaves you. You're always a part of that area. And I was always coming back because I thought that things had not changed like they should have. And looking at the other cities, other places where I lived, I never really saw the wastewater problems exist there that I saw in Lowndes County. And when I grew up in Lowndes County, we did not have, when we first moved to Lowndes County, we had an outhouse and had what they call in Alaska a honey bucket, which was used for one to relieve themselves when they had to use the bathroom. And then later, we developed, USDA provided funding for people to get indoor plumbing, and indoor plumbing was provided, and people moved away from outhouses to indoor plumbing. But later, with septic tanks, initially they were cesspools. Then the septic tanks started to fail in some areas. They were put in, and the regulations changed. And as we started to get more and more rain, there was more and more failures. In my own household, the sewage would run back into the home, but we thought it was a plumbing problem. We never thought that it was a problem because once it left the house, it was coming back into the house because of the failure of the septic system. Then, of course, when I got involved, I came back to do economic development in the county. Actually, I had been involved in Selma, Alabama, and working to get the first Black mayor elected in Selma. And that was in 2000. That was during the 2000 election when we couldn't determine who the president was, kind of a forerunner to some of what we've had to deal with in recent times. But I was, after working with that campaign with the NAACP Voter Empowerment Project, I was asked by one of the county commissioners to consider doing economic development for Lowndes County. In the process of doing economic development, we invited a person who is a Black political conservative named Bob Woodson to come to Lowndes County. And we took him around and showed him things like a coal-fired furnace that was still in one of the schools. The soot from the coal was still on the outside. You can see it on the wall. The gym walls were just full of the soot. And they talked about how they had so many asthma problems in the school that teachers and students were out of school during the winter months because of the soot on the wall from this coal-fired furnace, something that most people would see in a museum and not in an actual school. And then, of course, we also were another county commissioner told me, Katherine, you have to take Mr. Winston to see this area. We went there. It was out Lowndes County, 714 square miles, mostly rural area. There are 6 towns there, but they are very, very small towns. And where we went was outside of the town of Fort Deposit. And there was a family there called the McNeeds. And we drove off County Road 45 to turn on to the area that led to their compound. You could see the raw sewage literally running down the road from the failed septic system they had. And they had about 3 or 4 mobile homes that were sitting there that different family members lived in. And Mr. McMeans met Mr. Wilson was crying because he had been arrested. He and his wife were both placed under arrest for having a non-functioning septic system. And their septic system, they had put a lot of money and people had raised money to put into these septic systems and they were still failing. The irony is that one of the persons that was engaged in doing, supposedly repairing their septic system, just recently received, as part of a project that recently received at least $4 million to put in place more septic systems for other communities. And I mention that specifically because near the end of my talk, I'm going to talk about accountability and the role that I'm currently playing and making sure that whatever infrastructure dollars doesn't go into projects that ultimately keep putting people in the same situation that they were in the first place. So Mr. Wilson and I went to see the judge after we visited the McNeeds, and he talked to her about no longer arresting people. And ultimately, it led to a meeting with the State Health Department, where the State Health Director at that time acknowledged to us that in all 67 counties in the state of Alabama, there were wastewater problems. And he talked about even on the lake where people were built homes there, they were sometimes straight piping or had failing septic systems as well. And I didn't realize how big this problem was until I actually had my own experience, which I explained in the video, being called to the home of the woman who was in her 20s and pregnant with one child already. She had, her oldest child was autistic. And outside the back of her mobile home, when she flushed her toilet, it went into a pit that was full of raw sewage, and it was during the month of October. And there were so many mosquitoes there that I wasn't prepared for that. And I was wearing hose in through my hose, the mosquitoes bit me. I could see the blood stains on my legs. And when I later broke out in that rash and I went to my doctor and I asked her to test me, and all of my test results, my blood test came back negative, didn't show anything being wrong. But I still had this rash on my body, which stayed on my body for almost 6 months. And we were trying to figure out what it was. And she eventually sent me to a dermatologist who actually did a biopsy. And I still have a scar on my ankle for where he tried to determine what was causing this. And through all of this, it was later that I read an op-ed that was written by Dr. Peter Hotez, who's the founding dean of the National School of Tropical Medicine at Baylor. And he talked about how these issues are seen in countries that have wastewater problems. That was the thing that stuck out to me. He also talked about houses not having screens and mosquito-borne illnesses. I had never heard the term vector-borne illnesses before, but it resonated with me. And I actually sent that article around to a number of people when I read it. And eventually I Googled Dr. Hotez and found his information and wrote him. And that led to the Parasite Study. And when I met him and I told him about I suspected that there was something in Lowndes County that most doctors, American doctors, were not being trained to look for, because America does not even acknowledge that there's raw sewage on the ground. That's a third world problem. That's something we find somewhere else and not in this country. So he told me that, he said, I'm going to send my parasitologist there and we're going to look for hookworm. And I really didn't know what hookworm was, but I went and looked up hookworm after that and realized how hookworm had been endemic in the South. And even later, there were some people, some whistleblowers within the State Health Department that gave me information. One of the things that was given to me was a person that was written by an earlier health director who talked about hookworm along the Gulf Coast and how hookworm, that the Gulf Coast of Alabama was at one point was ground zero for hookworm in the state. But we knew that there had not been a recent study on hookworm because it was assumed that it was wiped out. But what we were able to do, Dr. Hotez sent Dr. Mahia to Lowndes County, and we collected fecal soil, water, and blood samples. And what was really interesting about that, and this is for anyone that wants to do this kind of work and go into community, it's very, very important that you partner and collaborate with people that live in the community. Because when Dr. Mahir went there the first day, people were very reluctant about giving him any sample. And we actually told him to go back to the hotel and stay there and let us do it, because we knew that we were from the community. And even when when we planned the study, which we had proceeded with a house-to-house survey to determine what raw sewage was in Lowndes County, we hired people that were from the local community who actually lived in the community that folks trusted. One of the things that I've found out since working with universities is that people go into these communities and don't establish any kind of relationship. And sometimes they go into the communities more interested in producing a paper than they are getting to know people. And as a result, violate a whole lot of the principles of environmental justice in the process of trying to do these papers or to get these studies done. And in our community, we have the legacy inspector of the Tuskegee study that people still refer to today. Just as a side story, I was looking for information on COVID vaccines here in the state, and I knew that they were being offered at CVS drugstores here. And when I went online to try to see if I could make some appointments for some people that needed the vaccine, the one place that had a lot of openings for vaccines was the CVS in Tuskegee. So, and I knew, I had to chuckle to myself because I knew why a lot of people were reluctant to get the vaccines in Tuskegee. And even the mayor of Tuskegee had spoken out against the vaccines because, again, she said her father had been a part of the Tuskegee. And the people that I encouraged to go and get the vaccines there, I know one couple, she said her husband said, "I can't believe you talked me into going to Tuskegee to get a vaccine." But the specter of Tuskegee still lingers today because they were more interested in seeing what was going to happen to the victims who had been exposed to syphilis than they were in telling the truth in that study. And that now lingers, and a lot of people of color are very afraid to participate in studies going forward because of that. So one of the things that we do with the Center for Rural Enterprise and Environmental Justice is that we try to teach people, or people especially at universities that partner with us, how to go into the community and establish this type of respect. And you can't do it in one visit. And establish the type of respect that's necessary in order to encourage people to participate. And they have to also be a part of designing the study as well. And that's what we did. And even later on with Duke School of Global Health, when we did a study, they designed a survey. But as part of that, the people that helped us do the studies that we've done in Lowndes County, who are not academics, they're just local people that live in the community. Some of them, their history and trust goes back to the civil rights movement in Lowndes County because their family members were involved or they were involved. So for that reason, they can go and get information that I couldn't get. But what we do is that we sit them down with doctors and academics, and they even went over, for an example, the study questions to determine whether or not these questions were ones that local people would respond to. In a lot of cases, they had to rewrite the questions so that the questions could they could get responses. And we have to, those are the kinds of things that we have to do. And more recently, my role with the I was recently appointed to the White House Environmental Justice Advocacy Council, which would be advising the Biden administration about environmental justice. And there are 27 of us from around the country. And I have one of the positions that I have on that council is as the I'm one of the vice chairs. And all of us feel that it's very, very important that we have that everyone needs to understand the principles of environmental justice, or we continue to repeat the mistakes of the past. And one of the things I've learned with my affiliation with Equal Justice Initiative, that we have to respect the history. And EJI, if you haven't had the opportunity, at some point when hopefully the world opens back up, come to Montgomery and visit the National Memorial of Peace and Justice, which tells the story of the many lynching victims throughout the South. And some of the lynching victims were not just in the South, because as a Southerner, sometimes I hate when people tend to think that only that racism only exists in the South. We found out last year, for those that didn't know any differently, that that's not true. But at this National Memorial of Peace and Justice, get a chance to see the history of so many places and how it impacts how we interact with each other. And in going into these communities, it's important to learn the history. In Lowndes County is located between Selma and Montgomery. And prior to the voting rights march, there was a lot of history, a lot of things happened in Lowndes County. W.E.B. Du Bois actually did a labor study in Lowndes County in the early part of the 1900s, where they also did a survey. And they looked at how people were treated at the end of slavery and how sharecroppers were treated, because there had been a sharecroppers union in Lowndes County that was put down by violence. There was so much violence in Lowndes County, in fact, it was known as Bloody Lowndes. And the reason I can do the work that I do in Lowndes County is because of my parents' involvement in the civil rights movement there. And when I go to a lot of areas where people remembered my parents, they have a story to tell about something that they did, which helped me to gain their trust. And we have to learn the history and be able to understand that. So when I take people to Lowndes County, one of the things I do is I teach them a history lesson, whether it's Bernie Sanders or whether it's Jane Fonda, who's also visited us in Lowndes County, that we talk about the history. Actually, Jane and I went to the Sunday before we went into Lowndes County, we went to the National Memorial of Peace and Justice, and she actually saw there they memorialized people based on county or city where there were numbers of lynchings, and there was a public lynching that took place in Nebraska in Omaha. And she said that her father, Henry Fonda, actually witnessed this lynching take place, and it had a lot to do with why he played the characters that he played later on in life. These kinds of lessons also apply when we talk about how people respond to studies. My mother had been a victim of sterilization. A lot of people don't know about that, that people were sterilized in Tuskegee as women that were poor from the Black Belt that would go there to have their babies. As a condition of them going there and having their children delivered was that they had to be sterilized. And my youngest brother, the person who sterilized him, his name is on his birth certificate. So these are all very, very important environmental justice factors. And we're concerned that when we start really looking at this, and I'm glad that this administration is using environmental justice as a lens to measure equity. And we also need to have medical equity too, because that does not exist in the way it should. I have, and through looking at all of this, it can determine whether or not a place like Lowndes County, 714 square miles, according to the census, less than 12,000 people, has the highest per capita death and infection rate from COVID in the state of Alabama, all 67 counties. I mean, there are so many factors that go into that, and equity is one of them. So my role with this advocacy council, with WEJAC as it's known as now, my role would be to work on trying to establish some type of measure in which we can talk about equity, and whether or not the funds that this American job plan that is being proposed, how are they going into these communities? And I think it's about more than just putting funds into communities. We also need to make sure that when we put these funds into these communities, that the hospitals that have been closed or reopened, or at least that they're replaced with medical professionals that can go in and understand local folk and be able to provide the care that they need. Because without that, we're going to continue to have more and more poverty and more premature deaths. In addition to that, we want to make sure that that people don't make money, and at the end of the day, we have the same problems. I've been meeting with officials from on Capitol Hill who are working on legislation to put more funds in rural communities to deal with the wastewater issue. But my concern is that one of the issues that I raised was these septic systems that you're putting in these communities. Are these septic systems going to, are they coming with a warranty? The industry pushed back against it. They don't want a warranty. And I actually, for those of you that, if you've ever worked with me, I can get very impassioned by some of this. And my position was, I wouldn't buy a car that didn't have a warranty. Why would you expect people to get something that has an impact on their health to not come with a warranty? That means that these billions of dollars is going to be made available, that people can put in place systems in these rural communities across the U.S. with no warranty that will continue to fail because of climate change. And when it rains around here, septic systems fail. That means that it pushes the sewage back into the homes. And why did I raise that question? Because when we did our Parasite Study, now the people at Baylor don't know who the subjects were. We do, because they would not have participated if other people knew. But one of the things that I know is that the people that had the highest percentage of hookworm based on this study were not the people that were straight piping. It was the people that were paying a wastewater fee. The reason being is because the sewage was coming back into their homes and in their yards every time it rained. And actually, there was an example that's shown in the video where you saw where there was a child swing set. That's raw sewage from the lagoon across the street. They're still building sewage lagoons. And sewage lagoons are basically, and they're primarily putting them in rural communities. A sewage lagoon is just basically a pond full of raw sewage. So that means that that person's home gets the sewage from every raw sewage, because it hasn't been treated, from everyone in that town. It ends up in their yards. And we're seeing these problems happen around the country. So more recently, we have partnered with the Guardian newspaper. As you can see, the Guardian has been a long-term collaborator of ours. When we did the Parasite Study, we knew that most American newspapers were not going to realize how important this was, and probably wouldn't even publish it. So, and we had been told by some local engineers that nobody would be interested in what was going on because it was in a rural community and away from major media markets, and that sewage was not fixing. But during the 50th anniversary of the Selma to Montgomery March, I was visited by a reporter from The Guardian. His name is Paul Lewis, and he had heard about the Parasite Study. And he asked me, would we allow them to break the story because they're an international newspaper? And I said, yes. I said, you have to hold it for 3 years because we have to wait for it to be, we didn't know it was going to be 3 years, but we said, you have to hold it because it has to be peer reviewed. And we knew that, and you probably also know that if we publish it beforehand, then that would invalidate the study. And they held it for 3 years, and they broke that study, broke the story after it was published in September of 2017. And then a few months later, they were part of the team with Philip Austin, who was the UN Special Rapporteur on Extreme Poverty when he came to Lowndes County. And he said, you know, when I met with these people beforehand, they said, you know, we're not really talking about raw sewage. We're talking about, we're here to talk about poverty. I said, but you're going to have to understand that raw sewage and poverty go hand in hand. They didn't understand. But when they came to Lowndes County, they actually saw what I was trying to get them to visualize. I remember the reporter asked Dr. Austin, we were standing at a place where there were a group of mobile homes, and you could see the sewage was in like a ditch, and next to the ditch was a child's basketball goal, and you can see where there had been balls and so forth that had fallen into the sewage and they wouldn't get it out. But right across there was the water line just above the raw sewage. And I remember one of the reporters asked Dr. Austin, how did he feel about this? And he said that this is uncommon in the first world. And I believe that we're going to see lots of illnesses around the country that are associated with raw sewage because people didn't realize until we brought it to their attention that it's a major problem and that it is a problem not just in the South. I went to Centerville in Illinois, and in Centerville, if Centerville is outside of St. Louis, I had to fly into the St. Louis airport to get there, and it took us about 20 minutes of driving to get there. I saw more raw sewage and toilet paper from the remains of what had come out of people's toilets that day in that city along the streets than I had seen anywhere. So when we partnered again with The Guardian to do this story, it's going to be a year-long project where they're looking at raw sewage around the U.S. And we also found out that the government is not documenting this. They have no real numbers to know where raw sewage is in the U.S. and how many people are impacted by it, largely because it's in rural communities. But we're starting to find areas that are not rural that also have sewage issues as well because of failing infrastructure or places that never got infrastructure. And even here in the state of Alabama, in the capital city, there are people here in Montgomery that are on septic systems that are in the city limits, and their septic systems are failing too. And recently, actually, one of the meetings that I have today is dealing with this problem. I was brought into this by a city councilwoman who represents one of the districts, and the mayor's office got involved recently. And I asked them what they do, get with the Water and Sewer Board and find out where sewage stops in the city, and also where and who within the city limits don't have sewage treatment. And they all tend to be poor Black communities. And when we had the meeting with people from the Water and Sewer Board and asked them why would they not extend their services, they provide water to those areas, and they said, well, the developer should have built the sewer mains there years ago when the people lived in those areas. But again, if you look at the history, a lot of those areas were redlined. Those are the only places Black people could live, and legally they were not, because of Jim Crow laws and regulations, they were not putting sewage in those areas. And now they're using those same, they're trying to create the same obstacles. They're creating the same obstacles that prevented people from getting sewage treatment in the city limits in the first place. Then more recently, you saw we're in Jackson, Mississippi, because of the climate event that made the news in terms of Texas. It also happened in Jackson, where because there was a freeze for several days, the pipes burst. The mayor of Jackson described the pipes there as being pretty brittle. And the communities that suffered the most were the Black communities in Jackson, who they not only couldn't drink the water, they couldn't flush their toilets either. And I just remember seeing pictures of people taking them bottled water. And it was very, very similar to what I saw in Flint, Michigan. In Detroit, where they're having massive water shutoffs because of failing infrastructure. And the water bills are so high, people are getting water bills $700 to $800 a month because a lot of it is going into the ground. When they turn the water off, they can't use the toilets either. And they're having a lot of health problems there because of that. Actually, Michigan is starting to see an uptick in COVID infection and death rates right now. And I wonder how much of that has to do with, especially in one of the largest cities, they're having these massive water shutoffs. And then, of course, we're getting ready to do a story that's coming out very soon. One of these areas is in one of the wealthiest parts of New York. It's probably the wealthiest county in New York. There's a Black enclave there where the sewage is coming back into people's homes and on the streets, and some businesses have closed as a result. That's the story that we're going to be doing. So people are self-reporting with this project that we have, and we're asking them to self-report where they have wastewater problems, and the reporters are following up on it. And we hope to be able to map over the course of the year these areas where people are self-reporting. Yesterday, I had a conversation with someone who's also a member of the WEJAC, who lives in Alaska, who talks about the issues that are happening there around health and environmental justice, not just wastewater. But she said that she grew up on this island that's really close to Siberia, and there was a military installation there. And she talked about the chemicals that they have there and how they're struggling with cancers there because of the chemical exposure. And pretty much when the military closed the base, they abandoned the local community too, but they're still dealing with the legacy of the cancer. And she said that she was a cancer survivor herself and had lost several family members to cancer. But she grew up using a honey bucket, and a lot of communities in Alaska are still using honey buckets because they do not have water and wastewater infrastructure. And when my book first came out, and I think I did, it may have been C-SPAN, but a person reached out to me through social media who is part of a group of veterinarians in Alaska. And they said they're treating stray dogs and they're starting to see hookworm in stray dogs in Alaska. I mean, that's where this environmental justice issue meets climate justice, because we're going to see diseases and health problems in areas, the type of diseases and health problems where these diseases could not live before. And of course, not to mention with these melting ice caps and what is there that we have no cures for. I think that COVID is a precursor to what we are going to be dealing with. But my hat goes off to those of you that are on the front lines of this crisis, because a lot of you expose yourself and expose your families to treatment. And I believe, we talk about the folk that we should honor as our real heroes. I think our real heroes in this crisis have been those of you in the medical profession who served despite not getting the help that you should have gotten, getting the PPE that you needed. We see you, and we know that you did a phenomenal job, and you're still doing a phenomenal job. And I think at some point we need to have some monument to the medical profession because of the role that you have played during this crisis. And I think that the knowledge that you've gained from this is going to be able to help us with these other crises that are sure to come, because we still don't understand the relationship between climate justice and environmental justice and the choices that we're making, and how it's having an impact on health around the world and not just here in the United States. So I will be, I'm going to end with this before I start taking questions. I will be engaged in a dialogue with a member of parliament tomorrow. We're doing it through Instagram. And his name is David Lammy, who has been speaking out about environmental and climate justice. And the interesting thing is he did a YouTube, he did a TED Talk that talks about environmental and climate justice around the world. And some of the things that he talked about, the asthma rates, and who can breathe clean air and who doesn't, and how close they are. This is happening around the world. It's not just an American problem. We're seeing this happen with poor people and people of color around the world. And that is why it's so important that we focus on global health, but we also look at it from an environmental justice and a climate justice perspective, because otherwise we're going to be blindsided the way we were with COVID. And we'll be put in a position where we're not prepared to deal with what's to come. And I still feel that the wisdom, the indigenous knowledge that we're getting, that is there, that we can incorporate it to solve a lot of these problems. And last year was a very trying year for me because I went to the doctor and found out I had problems with my esophagus, but I had the problems with the esophagus because of an earlier surgery that I had, and I had gotten a gastric sleeve, and that sleeve had to be reversed to a gastric bypass. And in the process, I went to the same doctor who performed my original surgery, And when he did the bypass, uh, he initially told me that I would be in the hospital for several days, and the next morning he came and told me that I was being discharged. And I went home and I knew something was wrong because I never had a problem recovering from surgery. But this time I had problems walking from my bed to my bathroom. And I went back. Surgery was on a Monday, sent me home on a Tuesday. Sunday morning I was back in the hospital, um, barely able to breathe. I had pneumonia. I had pneumonia because he had cut the vein to my spleen and sent me home and didn't tell me. And I was bleeding internally, and my spleen was dying inside of me, and I had to have surgery again to have my spleen removed. And that experience taught me a lot about, healthcare disparities, how doctors need to be taught how to communicate with their patients. And in this particular case, he did not communicate with me. He felt that, in this case, I felt he was playing God when he sent me home, but there was something greater that felt that I need to go back to the hospital. And I told him, I wanted him to tell me the truth before I let him do surgery on me again. And he did tell me the truth. And I told him I was going to give him an opportunity to straighten his out. And he did. But all of this happened just prior to I was released from the hospital March the 7th, and went back to the hospital March the 13th to have last year to have my staples removed, and the governor shut down the state at the end of the month for COVID. So I have spent this whole year or so at home recovering, as well as, and I have not been able to see a doctor in person since being released from the hospital, getting my staples taken out. It's all been by phone, but I think because the doctors that I ended up landing with were good at listening, and I talked to them about environmental justice, and I talked to them about how it's important listen to one's patients to make sure that if something goes wrong, you know it and you can deal with it right away, or to tell them, and so that they can be aware as well. But all of these things that I learned in the past year, I think, and that you also probably learned in the past year, are going to help us do a lot of the healing and the reconciling that we need to do in order to have a healthier planet, a healthier population, and certainly a healthier future. So thank you for inviting me to be a part of this event. And for me, I'm better when I'm dialoguing. So I know I did a little freestyle today, but but I'm better when I'm dialoguing. So I like to spend the rest of my time engaging and taking questions.
Thanks so much, Ms. Flowers. It was incredible. You spoke about heroes. You're certainly a hero and a true advocate and leader. We have the privilege this morning of also being joined by Dr. Katrina Armstrong, the chair and chief of the Department of Medicine here at MGH, who has a sustained commitment and passion for rural health. And I would love to turn it over to her to give a few words, and then we will, with the remaining time, do some question and answers.
Well, so Ms. Flowers, I guess I just want to, my only words here are thank you, which is, as Garen knows, I grew up in rural Alabama. I have a lot of friends in rural Alabama, and I think you speak the truth about what it means to live in those communities and to think about the justice issues that exist for race in Alabama and across our world, across our country, are fundamental to environmental justice, but also to health justice. So I guess Garen, maybe if I can ask a question to start, I guess the question I have, Ms. Larson, listening to you is I think about the pipelines for people to get engaged in these issues, particularly from the health side. I'm just curious how you reach out to, what do you get back when you talk to young people, younger than I think what you're seeing here with me and Dr. Ivers and Dr. Stone, as you find this resonating with the young people in Alabama, across the South, and these communities? I think their engagement in this is so important for people to move forward. And so I'd love to hear about that.
Yes, yes, we're seeing a lot of young people are being engaged. I mean, like this evening, I'm speaking to students at Talladega College evening. Last week I spoke with students at Huntington College. And Huntington, for those that don't know, is a Methodist school here in Montgomery. It is Christian and conservative. Um, it was, you know, a lot of people talk about my relationship with Jeff Sessions, who's a friend of mine actually. Because you know, people, you know, they talk about the South and how, you know, the South can be kind of strange sometimes, but there, he and I develop a very good relationship based on our interest in rural communities. But he's an alum of Huntington and had 1 point set on the board there. So when I spoke with him last week, one of the questions that was asked of me was, how do we deal with, what do you tell young people who are despondent about the future and think that the world is about to come to an end because of what they're seeing with climate change? And I was surprised to get that type of question from students at Huntington. But what I said to them was, the way you get over being despondent is to get involved. And if you're truly concerned about climate change, I want you to go with me to Glasgow. And so you can connect with young people from around the world that are also concerned about climate change. So since that time, the academic dean of Huntington has reached out to me. The students are already organizing. And they're trying to organize because they want to go to Glasgow, and whether it's, and even if it becomes where it has to be virtual, they want to be engaged. So I'm getting lots of great results from young people from around the U.S. that want to be engaged. And we actually have an internship program that we're going to launch this summer, where we're going to have interns to be engaged in helping us to document the wastewater problem, do some research. And these young people, since we can work virtually now, they're coming from around the U.S. And I think that it's important for us to collaborate. We have to have collaborations, but we have to have collaborations using the principles of environmental justice. There were young people that were engaged in the Parasite Study. I mean, the lead doctors on the case, of course, were the professors at Baylor, but these were young PhD candidates that actually did that research. And I'm working with the University of Illinois. There, I'm a Leavenworth resident. They're working with them, and they're trying to engage, and they want to work with us in Centerville, Illinois, to help resolve the issues that are happening there. So yes, we've gotten a lot of young people reaching out, the University of Alabama, Auburn, um, a lot of schools that people don't know about that are in these areas, as well as from universities around the country. This is definitely resonating with young people. And it reminds me of when I went to Standing Rock in 2016. I was just so moved that when I got on the plane to fly into Bismarck, that there were a lot of young people there with their backpacks. Their parents didn't even know that they were on their way to Standing Rock. And when I got there, to see so many young people that were there from around the country. So I think the young people last year, they spoke. We saw that loud and clear when they went to the streets protesting what happened with George Floyd. And these were young people from all races. And Alabama was not exempt from that. It happened here in Alabama as well. So I think that this is a moment where young people feel that they have to lead. And I think my role at this point is just to be an elder and provide guidance.
Thank you so much. We are unfortunately at time. I know we had many questions that we would love to dialogue with, and I think there's a small group session coming up in a few minutes, so we'll have some chances to continue this discussion. But I really can't thank you enough, Ms. Flowers, for joining us this morning and sharing about your leadership advocacy. And we are excited to continue the dialogue. And it sounds like you have a number of academic partners, and I know that we would love to consider ways that we can also engage with you and support your work and leadership in environmental justice.
I would love that, because one of the persons who advised us in the background on the Parasite Study was Paul Farmer, Dr. Farmer. So yes, would love to talk about how we can collaborate and work together in the future.
Sounds great.
Thank
and for
you.
all participants, thanks for coming. The panelists, thanks Dr. Armstrong, Dr. Ivers, and we invite you back next month for Global Healthcare and Rounds. We'll have Dr. Rupa Dutt from the Women in Global Health Council.